So this is an initiative that is a partnership between the Rennie Center, BRIGHT program out of Brookline Center, and Massachusetts School Mental Health Consortium, sponsored by the Department of Elementary and Secondary Education. And the whole intent here is to support districts in building comprehensive school mental health systems. We want to get you off the ground, dig in on PD and coaching opportunities to ensure that our kids get the best supports possible. We will be providing some peer learning cohorts coming up, but for to date, we've done a lot of PD sessions like this, and there are our partners. That's what we're all about. So thrilled that you're here today, especially given the fact that you're here for a topic that our kids need us to be sensitive to. We need to understand disproportionality data such that we can uncover those systems, practices, policies that are perpetuating inequity. So here's our agenda. We're going to talk about what is disproportionality. Courtney's going to march us through some discussion about that's really going to set the stage for digging into the topic. We'll talk about data systems and data sets across tiers and domains of need. We want to really paint a picture of how we access data and how we use that data to be able to inform this work. We'll do a quick data needs assessment, talk about what you have, what you don't have. I think one of the common themes that we'll see is that most districts don't have a lot of psychosocial data to draw upon. So how do we address that? We'll offer some feedback in terms of how we really get at addressing that need. And then we'll start unpacking some data to identify disproportionality. We'll teach you how to calculate disproportionality, and we'll get at the why of it. And that's the hardest part. You know, you can do the math. I'm sure all of you can do the math, but once you do the math and you find the problems, well, that's where the work begins. So let's take a quick pause. Give me a thumbs up if you're with me. You're ready to jump into the session. Courtney is 2 thumbs up. My God. Molly too. Good times. All right. For those of you who have recently joined, if you can come on camera, cool. If you can't, join us in the chat. Come off mute. We encourage participation. We do not see it as an interruption. We see it as good engagement. So I'm going to kick this over to Courtney. Courtney, just let me know when you want me to advance the slides, and I'll take care of it for you.
Okay, will do. So for those of you that were able to join me yesterday, welcome back. For those of you that weren't, we just kind of want to talk about what does it mean to actually take a step toward equity in school mental health. And so what you'll see here is there's some questions that we have to answer. One, what are our initial questions that we ask ourselves and we're asking of each other when we think about equity? The first thing you want to know, is there a problem here? You know, do we have an equity problem? How do we know? Why is it happening? What can be our plans to address it? And how will we know it's working? And so those are just 4 of the basic questions that can guide and frame the work. And so in doing that, when you ask those questions, and John, you can go forward now. As you ask those questions, one of the things we encourage is the use of data. And the reason we think about data is because it can help you say, is there a problem? It can help you say, why is there a problem? You can locate it to particular areas or particular policies or particular procedures. You can also use it to monitor and say, you know what? Am I changing anything, right? And so the bigger thing we say is use data. It's a treasure trove and it's a starting place. It's like, what should I do now? The other thing data is really good is saying, where can I have the most impact? Because a lot of times we'll do something that might impact 3 people, but we want to be able to have a large impact and definitely want to make sure that we know, are our changes making a difference? Because the worst thing to do is to implement a fabulous program and offer resources, and the people you're doing it for is like, this isn't what I needed, this doesn't help, and it doesn't change any of the outcomes. So you want to constantly have a feedback loop, constantly be looking at whether or not you're making changes. The other thing we know is schools collect all kind of data. So it's there. It's just the lens through which we need to look at it. And so on the next slide, you'll see one of the lenses that John is going to talk to you about is the why of calculating disproportionality, right? Because disproportionality can be the tool to tell you, is there a problem, where the problem is, and it can also get you to the starting place of even asking yourself, so what do I need to do differently? Right? And disproportionality lets you look at multiple different areas of things that are happening in the school. You can look at discipline, you can look at instruction, you can look at teacher expectations, misconception, you can look at family. Disproportionality allows you to take what may be a small picture and to really zoom out. And so we really wanted you all to come to this session, and John is going to walk you through how do we actually take data and look at disproportionality. And so, John, I'm back to you.
All right. So let's define this. Let's really dig into. I like this definition. It's coming out of the National Association for School Psychologists. So we're referring to a group's representation in a particular category that exceeds expectations. I want to go back to that piece, that expectations piece, because there's a number associated with that for that group, or differs substantially from the representation of others in that category. Gives a couple examples in here of some disproportionality that we could see. So special education disproportionality has been referred to as the extent to which membership in a given group affects a probability of being placed in a specific disability category. So if I am part of this group, do I have a greater chance of being represented in a disability category, such as maybe a neurological disability or maybe a learning disability? Disciplinary disproportionality, we're talking about higher than expected rates of suspension, of exclusionary discipline practices being levied against a specific group. I want to be clear here that when we talk about disproportionality, we're really talking about over or under representation relative to outcomes. That expectations piece that I flagged earlier, we're going to put a number to that, and that number is going to be reflected in the data that you bring to the table. So I'm going to show you some data sets that you might know about, that you might not know about, and that's going to inform how you get to that expected number, because it's not a fixed number across districts, but it is going to be a fixed number within your district or within your school. And we'll talk about that more and give some clarity to that. But suffice to say, you're going to need to know, one, what is the expected representation across race, ethnicity for each of the outcomes? That's something we can point to. And then ultimately, what are the data sets that we're going to look at such that we can compare between the expected representation and the actual representation? I want to give a quick pause there. You with me so far? Is this making sense? Will, what do you got?
I just wanted to share a thought, being a special education administrator, the disproportionality in special ed often is a result of school districts who have all good intentions of trying to support kids. But if special education is the only game in town to really support kids, then you're going to naturally see a higher, referral rate and identification, because educators want to help kids. So they're going to say, if that's where we got to go to get kids help, that's what we're going to do. And I think that school districts need to be very mindful of, there's other ways to support kids other than sending them down to the station called special ed.
Will is a systems thinker. I love it. Best of intentions can lead to ruin, unfortunately. So we do have to, I think what you're getting at, Will, is once we identify disproportionality relative to special education, we have to ask the why. All right, well, why is that? So you're 10 steps ahead. I love it. I love where your head's at. This is good stuff, Will. You're framing this well. So we're going to talk about that pretty in depth. That's the hard work. The math is easy. It's a couple quick calculations. But what Will's talking about here is the why. What, and that takes some heavy reflection. Why is it that we actually have this special education disproportionality? Will just put on the table his thoughts around it. Well, we're the only game in town. So obviously, well-intentioned educators are going to point to us to be that source of support. I guess my counterpoint to that would be, and I think Will's getting at this too, is, well, what are we doing before that happens? Like, shouldn't we be putting supports in place before special education evaluation? Gosh, that might make sense. That might reduce some of that disproportionality. Are people with me? Let's get a thumbs up in the chat. Thumbs up on screen if you're with me. Mary's with me. Gabby, cool. All right, thanks, Eva. Is it Eva or Ava? All right, Eva, cool. Okay, so let's start to brainstorm. This requires you to speak. Sorry. I mean, it's gonna have to happen, all right? In the chat or off mute. I wanna brainstorm what we would expect to see or some stuff that we're aware of for each of the following data sets. So what's some disproportionality that you're maybe aware of? It doesn't have to be for your district or school, but stuff that you know about in the world. When we talk about suspensions, over or under representation for suspensions, what's a group that is perhaps being over suspended, under suspended? MTSS for life, Molly. Yeah, I've got that tattoo, don't worry. What do we think? Over or under representation? Gabby offers Black girls. Gabby, go a little further. Over or under representation? L students. Eva, if you could do the same. Thanks, Gabby. I've seen that too, for sure. ESL, over representation. Yep. I've seen that. Let's go to chronic absenteeism. Let's brainstorm around that a little bit. What would we see? Some over or under representations relative to a group. What do you see? Yeah, Molly, homeless children with higher emotional disability diagnosis. That's pretty specific, but it's also very true. Now you're talking about multiple data sets. That's some high speed reflection. Gabby, foster youth are overrepresented in absences. Yep. Well done. How about dropout rate? What do we got? Over, under representation relative to a specific group. Dropout rate. Minority overrepresentation. Yep, Eva, good call. Anyone else? Addiction within the family leading to dropout rate. Yeah. Okay. Lower socioeconomic status, overrepresentation. Good call. LGBTQ youth. Thanks, Mary. Let's go to 4-year post-secondary matriculation rate. Our kids who are going to 4-year colleges, over under representation. I'm gonna throw it on the table. White students overrepresentation, 4-year. Yeah. There you go, Molly. Over, middle class white. What about underrepresentation for this category? Hispanic males. Yep, parents who did not attend college, so our first generation college students. How about mental health screening participation rate? This one might be a little unfamiliar to you. Okay, what do you think about this? Over or under representation for a group engaging in mental health screening? Molly's still on the 4-year lower family history with DCF. Fair.
No, I was answering
No.
the mental health screening.
Gotcha. Okay.
I know that sometimes families feel like if their mental health status or the mental health status of their child may indicate abuse in the family, and if they were raised related to DCF or had run-ins with DCF, they may worry that if their child is depressed or anxious or suicidal, it may draw attention from DCF, so they avoid it.
Molly, awesome explanation. Thanks for clarifying. I love that. Love that. We've got another one, students with internalized behavior under, okay, very cool, well played. I want to ask a pointed question. Do we think that there are perhaps disparate participation rates between race, ethnicity? Who thinks yes? Do we think that perhaps there's over or under representation relative to engaging in screening for students who are Hispanic, Black students? Yep, Molly throws on the table cultural and religious reasons. Yep, Eva, thank you for that. So it is the case that, and then we got to ask why, right? We know it's a thing, then we got to ask why. That's the hard part. Let's do this last one, enrollment in mental health services. I think we're going to see some of the similar trending with participation in mental health screening. Fair? So thank you for engaging in this pretty simple activity across data sets. Does this make sense? Are you with me? Economic impact, insurance coverage, for sure, Will. Good call. Good call. White women overrepresented in mental health services. Thank you, Gabby. Yep. So we have to have that eye for over and under representation. We can't have an eye for this relative to our specific district if we don't dig into our data. I think we're pretty good at scanning society and calling out these things because we hear about it in the news or we hear about it from another district. These big trends are easier to see and call out. When I say dropout rate, you call out some potential groups that are over or underrepresented. You're able to do that quickly. However, if you don't look at your data, you're not going to be able to do that for your kids. Does that make sense? Thumbs up. We cannot assume that any of the things that you just said hold true for your district. We got to calculate that for your district. So let's talk about some student-specific data that we're going to need to be sensitive to. And I guess I'd want to see a yes or a no in the chat for each of these data sets. Social emotional learning data. So data that captures proficiency relative to the CASEL competencies. Who here has that? Yes or no? Will says no. Jennifer, no. Okay. Lots of no's. It's coming, says Molly. Molly, if you could, what are you using to capture that data?
So the district that I just left was using the DESA, the DESA, the quick one and the long form. And then here we're going to use something I'd never heard of, the Michigan something or other, but it is aligned to CASEL. And we're talking about utilizing the Harmony curriculum, which is CASEL connected and free.
Well played. I like that. There are some tools out there. I want to flag the CELIS project out of DESE, Social Emotional Learning Indicator System. It's a project in its second year. It's measuring directly student self-report of social emotional competence across the CASEL competencies. Good stuff. But there are other tools too. And Molly points out a couple. The DESA is one that I hear an awful lot. Mental health screening data, global functioning, symptom-specific data, engagement in screening. Who's got that? Yes or no? Anybody have screening data? Working on it. Okay. Cool. Spiffy? I don't know what that means, Molly. Say more. What's spiffy?
I'm trying to learn too. No, I'm in a new district, and that's something that they do at certain grade levels here. And it's a student questionnaire. But I'll have to dig into it more.
Okay.
I
No, I
was hoping
appreciate
you
that.
would tell me because I'm new at this.
Yeah. I mean, when I hear spiffy, I don't think screening.
Fair enough.
I think cool. Spiffy is a descriptor for me, but I like that. I'm excited to hear more. Jennifer, RCADs, yes, love me some RCADs. Revised Child Anxiety and Depression Scale. We use that in Methuen as well, grades 5 through 8. So this is, again, a student level data set that you could put under a microscope and seek disproportionality, figure it out. What about behavioral data? Everybody's got behavioral data, right? But here's the big question. Do you have office discipline referrals and minor behavior referral data? Who's got both? Anybody? I think my computer just exploded a little bit. Give me a quick thumbs up. Can you see the slide still? Yeah, okay. For whatever reason, just went AWOL. And then lastly, documentation of impact, progress monitoring data. This is going to be especially important when we want to look at the impact of services on specific groups of students. Let me give you an example. Group therapy program, using cognitive behavioral therapy, focusing on depression and anxiety. We progress monitor using the GAD-7 and the PHQ-9. As that service rolls out and as we look at the outcome data, I need to be reflecting on the fact that, well, did the students in this group have outcomes that are disproportionate? Is there overrepresentation for growth with this group compared to that group? Is there underrepresentation for participation in the group for this group or that group? Does this make sense? We good? So some student level data sets that are pretty specific to SEL mental health that I think we need to be sensitive to. I'm hearing that there are some gaps here, and I would expect that. I don't know that there are a massive number of districts that are engaging in universal screening. I get it, that's okay, we're moving toward it. Molly's moving toward it in a spiffy way. And we are looking at things like RCADs, PHQ-9, GAD-7. These are all really important data sets that I think we're gonna have to be sensitive to if we're gonna look at disproportionality when it comes to SEL and mental health for our comprehensive school mental health system. Okay, let's keep moving. This is important too. That student-specific data set, where I'm looking at maybe screening data. Well, we can aggregate that data out and get a sense of our larger population's needs. This is really the entry point for disproportionality data, because disproportionality data really is looking at percent. We're looking at the percent of a population and comparing it against the representation of that population for a specific outcome. So it does require us to aggregate that data. You might have a lot of student-specific data sets that point at a kid or 2 kids or 5 kids. We need the whole thing, the whole data set. Quick show of hands or yes in the chat. People are open to share. I would love that. Do you have ready access to your student data? Or is that a barrier? Is that a problem? Will does, good, excellent. Molly's calling that out as a barrier. Anyone else call that out as a barrier? Show of hands, thumbs up, yes in the chat. Eva has it, good. Anyone else? Your participation gets you points such that you pass this course. Just saying. I don't really get to hold that over anyone's head, unfortunately. So it looks like it's a balance between, yeah, I've got access to that data, and Molly's calling out as a barrier. If you don't have access to this data, you really can't do the work. So one of the first required steps for calculating disproportionality is there needs to be some transparency around the data sets. I'm going to show you some data sets that you will have access to, no matter what. Definitely. But there are going to be others that you might have to start to talk to people within your district, your school, about getting access to. I think of things like your behavioral data, the aggregate behavioral data. That's not something that everyone has access to. Aggregate attendance data, dropout rate, graduation rate. Certainly not all of the screening data or the mental health outcome data. So this is part of the conversation. We're definitely going to need access to data if we're going to do any of this work, okay? When we talk about data across tiers, we're talking about really the size of the data set in a lot of ways. At tier 1, we're looking at aggregated psychosocial data, community staff, student needs assessments, EWIS data. Who knows what the vocal survey is? Give me a show of hands. Vocal survey. Oh my. We'll talk about that in a minute. You all already have conducted the vocal survey, believe it or not. Screening data. When we start to get into tier 2, we're looking at things like progress monitoring data for the group therapy program, as an example. Show rate for group sessions, student parent guardian feedback around group services or tier 2 services. And then tier 3, we're looking at, again, progress monitoring data, but then also treatment plan data. What about fidelity data? Are we collecting data in a manner that we set out to do well? Are we doing the thing that we said we were going to do? Are we using the data as planned, or are we just collecting it? Because that's kind of miserable, right? You collect all this data and then you never use it. Doesn't do anything. And then are we implementing our services with fidelity? We have to make sure that we are not only saying we have a group therapy program, but that it actually looks like group therapy. So lots of different data sets that we have to orient to. We also have to have access to them. They can all be aggregated and disaggregated, but that requires access to the data and access to the data in a format that allows for you to manipulate it. Because it's all well and good if you're maybe data tech IT professional in your district says, well, you have the data. It's on this locked spreadsheet that you can't manipulate. Well, that doesn't do you any good. You're going to need to move this data around, filter it, manipulate it. It's not the case that you can just look at a spreadsheet and not touch it and get the same outcomes. Okay? I don't know we need to talk about this all that much. This is just the other side of the equation, right? Student-specific data and then systems level data. All of this stuff is stuff that we're going to look at from a disproportionality lens. So when it comes to data collection tools and systems, definitely going to be the case that identifying the tools you have and how they're employed by your district is going to help you to do the work. We're going to do an activity in a minute that is really going to unpack what you have in terms of data collection systems. Where this data is housed and who has access to it is almost just as important as the data work that you're going to do. Because if it's only the case that Will is the be all end all in terms of data for his district, then your data work will be only as good as Will's desire to be a data connoisseur. That's a problem. Not that Will's a problem. Will's a wonderful solution, but we need more than Will, right? We need lots of people looking at this data. So let's dive into this activity. I'd like for you to, and yes, this does require you to engage. Don't make me put you in small groups and monitor you. I'd love for you to come off mute. We'll just take 5 minutes. This is our small group, okay? I'd love to hear from you. How are you collecting data right now? When we think of those data sets that we discussed before, behavioral data, discipline data, mental health data, social emotional data, data around attendance, grades, how are we collecting that? What do we got? Come off mute, type it in the chat. How are we collecting data?
We have parents complete a form at the point of enrollment for high needs students. It goes to all students, but it allows parents to indicate if the student has experienced a lot of trauma. It's the ACE screener. It's optional, but it helps with placement once the students get to the school. And then we give the DESA also throughout the district.
Eva, I really appreciate you calling that out. I think that that's a potential opportunity for some great data collection. I want to offer a suggestion. The ACE screener is meant to be delivered to adults after the age of 18.
Yeah, no, there's a child one.
Okay.
We have the childhood one. Yeah.
Okay.
No, was it? Because the parents filling it out. The parents filling it out for the students. And then it just allows, when we're placing them, like we just did a huge kindergarten enrollment. So it's not like we're loading a classroom with a lot of students that are on the high needs from that screener anyway.
Awesome.
Right.
Eva, that's so great. And thank you for clarifying. One of the things I was going to suggest is, and it sounds like you've accounted for this, right? Use the child version one, but two, there are other measures that look at trauma, like the UCLA brief trauma screen, and that's going to give you some symptom specific stuff, and there's a life event checklist that's associated with COVID that might be helpful, might just supplement what you're already doing, but that's awesome work. You're going to be able to put that under a microscope if you have access to the full data set, right? That's the problem. How else are we collecting data? Love to hear from someone who hasn't jumped on yet. And Mary offers in the chat, does the YRBS count? Yeah, it does, Mary. Of course it does. That's a great data set. Is it screening? No. It's a de-identified needs assessment relative to your population. It counts. I think that's great. The thing that I would ask is, well, can we look at different student groups relative to the YRBS data? So as an example, could I take the aggregate YRBS data and look at the percentage of Hispanic students that answered this question? I want to say that the answer is yes. And that to me makes it a really valuable data set. So thanks, Mary. Jennifer also offers, we did the DESA survey towards the end of the school year. However, not sure how to move forward with next steps. What supports to incorporate for high-risk students? How effective was the survey due to COVID? What buy-in do we have? It's a good point, Jennifer. And then ultimately, I'm going to be a broken record here, but do you have access to that data, Jennifer? Or is it the case that it's kind of under lock and key and nobody's looking at it? That's a problem. Let's move on to this next question. Where do you house your data? What do we got? Where are we keeping all this lovely data? Is it, Mary, go ahead.
Sorry, I was just going to say, I don't work in the school, I work in the public health department. And so that's why I asked about the YRBS, because it's more of a, I think it's more population health forward facing, and we actually keep it on a public health website, and the school keeps it on their website.
Awesome, Mary. It's that to me makes for a good situation moving forward, right? You're going to be able to use that data. It's publicly available. So good call. Anyone else? Where do you house your data? Where do you keep it? Let me be more specific. Where do you keep your behavioral data? Where does that? You all know about my wait time. It's legendary. I'll sit here for hours, just stare at the screen. What do we got? Swiss and Aspen. Thank you for that. Jennifer's Aspen. Okay. Who has access to these student information systems? Everybody? Or a subset of people in your district? What do we think? Mostly administrators for Will. Lily Vet offers all staff. Okay, good. I think it depends on the data set too. I think one of the things I want to call out, and this I would love 19 yeses or nos in the chat. Is it the case that data is easily accessible and easily manipulated in your district by the staff who need to use it? Yes or no? I've got 2 no's. I'm looking for some yeses and nos from everyone else. Brian, Michelle, Stephanie, Jennifer, Gabby, Ellie. What do we think? Easily accessible by everyone who needs to use it. Will says no. Staff need to be trained more on how to access and interpret it. Jennifer says mostly admin. Okay. Fair enough. Stephanie says no, out-of-school partners do not have access to this data. Okay. So I wanna just be real about what we're gonna talk about next. We're gonna talk about calculating disproportionality data. It's gonna be real hard to do if you don't have access to the data. It's gonna be impossible to do for some data sets, because I'm gonna show you how to access some data sets that are public facing and that all of you will leave here today ready to use. But there are going to be some data sets that are district specific that if you don't have access to them, it's the end of the conversation. And that's the next action step that you really need to undertake, is getting access to those data. Okay? Ready to move on? Are we good? Will's good. That's all I need. This you can take a look at later. These are potential data sources that your district might have. I'll call out a few. EWIS data. This is through Edwin Analytics. If you don't know what Edwin Analytics is, it's going to be an important data set for you to look at a lot of different outcomes: academic, dropout rate, graduation rate, MCAS. It's also going to be the case that EWIS data is going to allow for you to so Edwin Analytics houses EWIS data, and EWIS data is really the early warning indicator system data. So that is a project from DESE that is pointing to different variables that they're saying, as a function of these many different variables, we're going to produce an at-risk rating. And that can help you to understand the aggregate impact of your school on students, and also target specific students for intervention. We can look at things like 51A's filed, mobile crisis calls, psychiatric hospitalizations. These are all data sources that you probably have in your district. How they're collected, where they're housed, who has access to them is the big question. Dropbox portal, the DESE Dropbox portal. Who has access to that here? Show of hands. Eva does, Will does. Okay. For those of you who don't, and you're in this discussion right now, today, it appears as though you have an interest in moving your district or school forward with data. You should probably have some access to the DESE portal if it's appropriate. So I'll let you take a look at all of this. I highlighted disproportionality data because it's a data set unto itself. But it's really the case that any one of these data sources can be scrutinized relative to disproportionality. It's not the case that it's really about ensuring that we do the comparison between our expectations and the actual representation of students within that data set. Which means that any one of these things, grad rate, attendance, questions that are answered on YRBS, all of those things can be unpacked and run through the ringer of calculating disproportionality. I'd ask for you to reflect on whether or not you have these data sets, how they're actually collected, and from building a comprehensive school mental health system standpoint, what are the ones that you need to prioritize? One in particular that I'm going to call out that I think is going to be massively important for you to scrutinize is the number of students accessing programs and counselors. Who is actually enrolled in a service with a mental health professional in your district? Another one, psychiatric hospitalizations. Do we count that? Some districts do, some districts say that they do, but it's really just like a stack of referrals in someone's office or multiple offices. So worth considering. I mentioned the vocal survey earlier. This is school climate data that you already have. You might not know about it. No one in here raised their hand when I said, do you know what the vocal survey is? This is it's called the Views of Climate and Learning Survey. It was administered to your students in grades 5, 8, and 10 through the MCAS. You already have this data. You've already collected it. Do you know how to access it? That's the big question. It is within the application list of the DESE Dropbox. You got to go to the Dropbox Central tab. And here's the key. You probably don't have the Planning and Research tab. You have to have your IT administrator set you up with it. Once they do, you're going to get these beautiful reports that DESE has put out. Vocal survey data broken out by subgroups across all your schools, and you'll get a district report. But 99% of the people I talk to say, what are you talking about? We didn't administer vocal. Yeah, you did. Just didn't know it. So that's a data set for you to just be aware of, and that I think can inform your work of building a comprehensive school mental health system. Great school climate data. Will, what do you got?
John, is the vocals, I see on the slide here, it says it's a survey administered during grades 5, 8, and 10 MCAS. Is that the questionnaire that's at the end of the assessment?
There you go.
Kids, yeah. So that's I think a lot of people don't know that that's the vocal survey.
Exactly. Sheila,
Yeah.
you came off mute. You want to, and you know a lot about this. What do you got?
It's administered now in 4, 5, 8, and 10
There we go.
since 2019, and this current year, DESE is going to put it into Edwin and also make a dashboard type report for districts. So we're trying to improve how the data is viewed, because it was getting unwieldy with Excel. So it might be delayed a bit because we still haven't received the data, but we're pushing it into Edwin, and so it's accessible there, but it also be in a dashboard type format because we've reached the limitations of Excel. So
Sheila, it's super helpful. I've already updated my slides with your helpful information. And I think it's 100% the case that this is a really wonderful survey with great data that I just want to make sure people are aware of. Great to hear that we're going to have some advancements with vocal. Running theme here though, friends, is these are data that you probably have to push on someone to get access to. If you don't have Edwin Analytics, if you don't have a DESE Dropbox portal, it's a problem. It's going to be a problem for you to do this high-level work with data. Sheila, thank you for jumping in, and I'm glad you're here. Awesome to see you. Okay. Who here knows about this? I mean, I'm wondering. DESE school and district profiles. Eva does, Will does. I don't want to go too far into this, but I'm going to give you a quick tour. You can see that, yeah? This is just public facing. Google DESE school profile. It's the first thing that pops up, right? I'll show you some of the Methuen data. Here we go. Methuen. It's going to be incredibly important for you to understand, and I'm going to go back to that original definition, so hang with me. The expected number of students, right? It exceeds or the exceeding expectations piece of the disproportionality definition, over or under representation relative to what we would expect. This is where you can get that expectation. Let's go under students and let's take a look at, well, here we are. If I want to look at race ethnicity for 7th district, right here, I would expect that the outcomes for any data set would equate to the percentage of students in any race ethnicity category for my district. This is where we can get specific. We're going to look at some specific examples after, but this is where you look. Is there anyone that didn't know about this or that is maybe not using it? Quick show of hands or no, John, in the chat, I didn't know about this. What do we got?
John, can I make a comment?
Go for it.
So I just wanted to alert people, this is a really great data source of information, but you do need to be mindful that there are times when school districts have not updated this data. So you may go in and look at it and think you're looking at current data and it's actually not. It may be a year or even 2 years old. Up in the, under the Methuen name, you'll see the 2021 that indicates that Methuen keeps their data up to date. But there are some school districts that are really backlogged, and sometimes you're looking at data that's like from 2019 or you know. So just to keep people aware that you need to be making sure that you're looking at accurate, up-to-date data, or if it's old.
Will, awesome point, right? The data is only as good as it is accurately connected or collected, rather. The state's put some data collection requirements on districts that really point us to saying with more certainty than not that this data is accurate. But to Will's point, wow, let's make sure. let's take a look. Is this the most up-to-date data? Good point, Will. Michelle, good. I'm glad you're learning so much today. That makes me so happy. Jennifer, you didn't know about this? Well, now you do, right? Easy to access. This is a massive database. I mean, you can look at student retention across race, ethnicity, and all these student groups. How about grad rate? How about mobility rate? Dropout rate across multiple years, right? To Will's point, look up here, 2020, not 2021. Why? Data's not reported yet for dropout rate. Still being calculated, running it through the ringer. If you're able to get access to this, which you can, you're going to cut out a massive amount of work. You're going to be able to calculate disproportionality for lots of different things, okay? In some ways, and I hope that this makes sense, the work's already been done for you in a lot of ways. It's going to give you, and let's look at student attendance as an example. For all students, the attendance rate in Methuen, 94.7%. Well, what about students with disabilities? 93.3. There is some disproportionality relative to students with disabilities and our aggregate student attendance rate. Does this make sense? This is like just too easy. Use this all day long. What about overrepresentation? Well, look at this. Female students are overrepresented in terms of attendance by a little bit, still worth looking at. Once you identify the disproportionality, now the work starts. Now it gets hard, okay? You got about 37 minutes left with me. We're gonna get into calculating some stuff. We're gonna look at specific examples. But this, my friends, is a database you already have access to, all of you. Use it. Make this easier. There are data sets that are not included in here that I think that's the hard work that you have to do locally to get access to those things. You're not going to see, as an example, Jennifer threw this on the table, I believe, the RCADS data for her district up here, right? That data is locally connected and is going to need to be scrutinized, not on this website, but using some of this data. I'm going to continually point back to enrollment, the students tab, the enrollment tab. This column in particular is going to be of great importance to you when we start to calculate things, because these are the expected outcomes. I'm going to give you an example. If I look at my behavioral data set or my discipline data set, chase this through with me, stay with me with this. And I see that this is weird. 60% of students who are Hispanic have been suspended at least once. Well, that doesn't jive. We've got about 45% of Hispanic students in our district. They are overrepresented. Their rate of representation is exceeding expectations. Are we following that? Does that make sense? This is really important. I want to make sure people are with me. Yes? Thanks, Mary. Mary's the only one with me. That's so sad. So sad. Will too. All right, let's keep going. We'll go back to the slides. Oops. We're going to start to get into calculating disproportionality, okay? I like this. There's a link right here. I'll drop it in the chat. Idaho's doing some work around risk ratios. I don't think you have to, I mean, that's a concept that they've somewhat like bought into. I don't think you have to like actually calculate the risk ratio, but the math of it's good. I like the math. It's easy, right? This just shows you how to do it. So let's take this example. There are 40 Hispanic students identified out of a total of 100 Hispanic students in the district for special education services in this example. So that means about what? 40% of students are identified. I would immediately want to go back to, does that exceed the expectations that I have relative to the percent of Hispanic students in my district? That's the big question. They're comparing it against the total population. There are, or rather, all non-Hispanic students. So there are 100 non-Hispanic students identified out of a total of 1,000 non-Hispanic students. So that's a 10% identification. So what they're basically saying is you're 4 times more likely to be identified for special education or a student with a disability in this example if you are a Hispanic student. That's disproportionality. Now the hard work. Why? We're going to talk about that. Does this make sense? Simple math? You can all do this math, right? This is nothing. Okay. Well, how about this math? This I need you to follow along with me, okay? The number of students by race ethnicity in the data set over the total number of students by race ethnicity in your district times 100 is going to give you the percent of total students by race ethnicity in the data set. Okay. I'm going to ask you to go back to this over and over. This is simple. It's simple math, but we're doing it on the fly. I'm going to give you an example in the middle here. What if we're looking at the chronic absenteeism rate for our students who are Asian in the district? Well, I need to know the number of Asian students who are chronically absent. I need to know the total number of Asian students in the district. Multiply that by 100, and that equals the percent of Asian students who are chronically absent. That third example is just really unpacking with real numbers this example. Well, what if I have 48 Asian students in my chronically absent data set, and I know that I have 120 Asian students writ large in my district? Well, times 100, 40% of Asian students in my district are chronically absent. I have to compare that number to the expected outcome, which is going to be the percentage of Asian students in my district overall. Let's talk about representing this data graphically. So we can really compare the rate of any data set to the percentage of the race ethnicity of the students in your district. Go back to that DESE school profile page. In red here, I'm going to show you on the next slide, these are all fixed numbers. This is a number you calculate, the actual and the expected. Okay. I think when we graphically represent these things, it makes it really easy to just digest this information. When I look at this representation of the percent of suspensions and the percent of race and ethnicity in district, I'm immediately drawn to the difference between Hispanic students and white students. That jumps out at me. I'm looking at the expectation, right, in red. That's the known quantity, the known variable, the percent of race ethnicity in the district. Well, that's weird. The percent of Hispanic students that have suspensions far outstrips the expectation. There's over-representation of Hispanic students when we talk about students who are suspended. Does that track with people? Does that make sense? Give me a thumbs up or a yes in the chat if you're with me. Courtney, thank you. Michelle, Jennifer, Jessica, excellent. Molly's with me. Gabby, thank you, Gabby. I appreciate the engagement, my friends. It helps me to know if you're with me. I guess my question would be, well, then what does that mean about white students in this district, in this example? The expectation is that we would see about 44% of white students suspended, all things being equitable, right? All things being equal. Equitable. What's going on there? What do you see when you look at the bar charts for our white students in this example? Somebody come off mute and get 100 points. What do we got?
Can you repeat that?
Yeah, Molly. Look at the bar charts for white students on the right. That's what we would expect. That's the percent of white students in this district. And then on the left in blue, that's the percent of white students who have suspensions. What's going on there? Or maybe let me simplify. Is there disproportionality? Mary, go ahead.
Well, it looks like white students, there's more white students in the district, but less suspensions.
Yeah,
Proportionally.
there you go. I think sometimes we can overthink this stuff too. White students are underrepresented when it comes to suspensions. I would expect, and this is the piece that's going to make graphical representation in this manner really easy. All of those paired bar graphs should be equal. Otherwise, we have disproportionality and inequity. We should be seeing equal bar charts for all of those paired bar charts.
John, I have a question or comment, I guess. Somebody that I used to work with cited a time where they were, notified through the audit, or whatever, the review process with DESE, that they were disproportionately suspending white male students. But the student body was almost entirely white, and then, a half being male. In that case, we identified that it was actually just an overuse of suspension in general. And well, I mean, I guess, I don't know, there can be other factors than targeting, if that means, like, So for instance, what we're looking at here, if this is number of suspensions, or this is percent of suspensions, number.
Yep.
Because they were in trouble for like the number of suspensions were very high. And so they adjusted practice to not suspend as much in general.
I think what you're talking about, Molly, is incredibly important. And I think what I'll repeat from what you stated was that there are other factors sometimes other than targeting. And I think that's true. I also think that targeting happens too, right? It's a both and for me. So this graphical representation of this data set starts a conversation. That's really the point here. This is verifying that for whatever reason, we are over suspending Hispanic students and we are under suspending white students. And the very hard work of figuring out why that is it targeting? Is it something in our practice of actually referring students for discipline? Does it have something to do with, I guess, like there are a ton of different reasons why that could be. Now we got to do the work of unpacking the why. That's the most important part of this. But if I were to take a look at this graph, I guess the one thing I can verify with certainty, something's going on. It shouldn't look like this. These should be the same height. These should be the same height. All of these should be the same height. That's just true. But they're not, and there's a reason for it, and we got to figure out that reason. Cool? With me? Moving on. Moving on. Look at this. This is a little bit of an explanation of that chart. So in green, those data remain constant because that's your expectation. You're drawing that from the DESE school profile, if it's up to date, to Will's point, right? In red, that red bar chart, that is the percent of race ethnicity in your district relative to each of those race ethnicity categories. So really, you can pop any data set alongside that and check for disproportionality. We happen to look at suspensions for, or actually, this example is about percentage of grades that equal A in the district. And we've got the same thing going on. So we went from an example where it was suspensions, and I'll ask for you to take a look here. Hispanic is about 44 for this imaginary data set. And here, Hispanic's about 44, because I use the same expectations, right? I'm drawing upon this imaginary data set, but this is going to change between data sets. This is going to be your attendance data set, your grades data set, your dropout rate, grad rate, mental health screening participation rate. In orange, everything being pointed to in orange, these data are the percentage of students represented in the data set by race ethnicity. And kind of just re-emphasizing, what does it mean if these two bar graphs are not equal? Well, there's disproportionality. That something's going on such that we are overrepresenting Hispanic students for this data set. And we're underrepresenting white students for this data set. This data set happens to be the percentage of grades that equal F. We can pop all kinds of stuff into there. This and this remain the same. That's what we would expect, right? So we've got about 22 minutes left, and we're going to get into the hardest part of this. What happens when you identify disproportionality? Because the calculation is easy. I've showed you a resource today where you can literally pull the percent of race ethnicity for your district. You can pull the percent of students with disabilities, the percent of English language learners. You can just get that immediately. It's at your fingertips. But getting at the why of disproportionality is the real hard part. That's the challenge. Because the whole purpose of this session and calculating disproportionality is to identify the systems, practices, and policies that are perpetuating inequity and resulting in disproportionality. That is the whole reason why we do this. We need to disrupt, dismantle, destroy systems, practices, and policies that perpetuate inequity. That's the goal here. And that requires us to ask why. And that is also a really hard part of this. I'm going to give you some scenarios. I want you to consider these scenarios, and I want you to share your thoughts around potential causes of these disproportionalities. Now, for now, no wrong answers here, right? This is a brainstorm. I'd ask that you just kind of blurt it out, okay? When we think about underrepresentation of a group in advanced courses, what could be a system, practice, or policy that is leading to that underrepresentation of that group in advanced courses? What do we think? Maybe it will help if I label that group. We have underrepresentation of Hispanic students in advanced courses. Why? Let's brainstorm some why around that scenario. Go ahead, Will.
Well, using your example of Hispanic students, depending upon, if they were raised here, born here and raised here, or did they come to the United States, they may not have gotten quality education at the earlier grade levels to be prepared for advanced courses.
So I'm hearing interrupted education.
Right.
Or
lack of quality.
Or a lack of quality of education. And perhaps, and I'm going to put it on the school and the district, we didn't support them such that they could get to that advanced course, perhaps. So it's, again, brainstorm here. Jennifer offers, suspensions have led to less time in the classroom. More time in the classroom results in more learning and understanding, and ultimately ability to join advanced courses. Jennifer, great, I love it. So you're saying that I'm proposing that one of the reasons why there's underrepresentation of Hispanic students in advanced courses is because we are suspending them at an extraordinary rate such that they are not able to be in the classroom and make the gains that we would expect for all our students. Jennifer, wonderful, I love that. Gabby says curriculum is not ESL friendly for students and parents. Great, thank you for that. Because we have to, and it is my expectation that we adopt a stance that all races and ethnicities are capable, equally capable of enrolling in and experiencing success with advanced coursework, period. So if that's true, and it is true, then why is it that we have underrepresentation of this group? Gabby offered a reason, Will offered a reason, Jennifer offered an awesome reason. Thank you for that. Let's grab another one. We've talked about suspensions. I want to talk about grad rate. Underrepresentation of, and I'm going to say, special education students for grad rate. Let's cook up some potential whys. What do we think? Waiting. I will outweight you rather. What are our thoughts here? Underrepresentation of special education students relative to grad rate.
Credit requirements and staff's understanding of implementation of accommodations.
Okay, so we're looking at practices that are perhaps positioning special education students such that they're not going to meet the credit requirements to graduate. Great, I like that. Do we have another one? Mary, go ahead.
You just said something that made me think. So there's expectations around like criteria, but then there's also attitudes, like staff attitudes, administration attitudes that maybe don't think children or students with disabilities are able to go to graduation. So there's a whole kind of another layer that's not just about policies, but it's about attitudes.
Yeah.
I think that goes along with like a competency-based approach versus a grade point average approach also.
Okay. I appreciate both your comments, and it makes me think, you know, one of the things that, you know, when we don't have the same expectations for students because of a group that they are part of, that does position them such that we are changing our approach to students because of the expectations we have for them, and that changes outcomes. That's inequitable, creates disproportionality. We've got about 15 minutes left. What about this? Overrepresentation of white students enrolling in mental health services. Why? Just as an example, this might be something that you uncover.
This is in school?
Yes. What do we think? What's a why that we could ascribe to that? Just a brainstorm why. It doesn't have to be a perfect why. Could we throw out there, yeah, Mary, cultural factors for sure. Stereotypes of BIPOC students being more resilient. Gabby, well played. Love that. These are all things that we have to question. Get at the why. We're not going to dismantle or disrupt systems, practices, policies if we don't ask questions about those things relative to these data. All right, let's keep moving. We're going to do some practice. So the data on the right, and this might be data that results from your good work calculating disproportionality, shows the participation rate for universal screening by race ethnicity. What do you notice it's worth calling out? What are you seeing? What do we think? I'll give you a minute, but only a minute. All right, I'm gonna start to call on people. Jennifer, what do you see? Molly, what do you see?
I think I'm kind of surprised, I guess, by the, like we had just talked about, students of color maybe not accessing or not engaging in that, and then it's higher for Hispanic and multi-race.
Thanks, Molly. Jennifer, no, thank you. Thank you for dropping that chat. Discrepancy between the student screen and actual students. Yeah, that's what I would call out. So we're seeing that we actually have overrepresentation for Hispanic students, or I'm sorry, you know what? This graph is reversed. The red and blue are reversed. So we have to actually like look at the legend and be certain, because the participation rate is actually underrepresented for Hispanic students relative to what we would expect. And
Sorry,
then,
yeah.
no, it's true. There was a non-purposeful trip you up. And for white students, we have overrepresentation for participation. I'm going to throw on the table, because this is a data set that I've looked at because we do mental health screening. I'm wondering, this is a question that I would pose to my team. Are we describing in a culturally responsive way the benefits of engaging in universal screening? Are we talking about mental services in a way that is culturally responsive? Are we describing the outcomes of mental health services in ways that are sensitive to and empowering for all cultures? Those are big questions. Those are questions that need to be asked. Those are the lingering questions I was left with when I looked at data like this. Let's look at this data set. So in blue, that's going to be our expectation. And in red, this is going to be the percent of students that score in the severe range for anxiety by race ethnicity. So I'm going to call out the thing that's worth calling out, okay? White students are overrepresented in the severe category compared to Hispanic students who are underrepresented in the severe category. African American students are overrepresented in the severe category. So I have lots of questions here. What are some questions that you have? What do you think? What are you going to ask of this data set? What are some potential questions that you need to ask of yourself, of your team, of the systems, practices, and policies that you have in place? What do we think? Some reasons for this disproportionality.
Maybe anxiety is viewed as a white thing, and with the same kind of behaviors, it's not identified as anxiety, it's identified as something else.
Thanks, Mary. That's a great question. It's a great, maybe that's the why. Will, what do you got?
Perhaps that society has greater expectations for white children than they do for children of color. So therefore, those expectations lead to heightened anxiety for white children.
Okay, thanks, Will. I appreciate all this participation. Ruth offers, thank you for this conversation. Former public health program developer, wonderfully rich conversation for educators. Thanks, Ruth. I appreciate that. You got to run, check the slides later. It's wonderful. All right, let's go to the next example. This is probably going to be the biggest ask I have of you today. I want you to use the table to the right to calculate the percentage of students with greater than 0 suspensions by race ethnicity. Let's actually do this out, all right? Let's not do the whole table because, my God, it's Wednesday during the summer. Some of you are still in bed. I know it. I know it. That's why your screen's black. That's okay. I appreciate that. I would do the same if I could. But I want you to calculate the percentage of students in the white race ethnicity category who have greater than 0 suspensions. Let's do that quick math. I'm gonna do it too. Pop it in the chat when you have your answer. The percentage of white students with greater than 0 suspensions. This is a data set that you're going to see. Jennifer, 25%, well played. I love it. Jennifer gets 500 points. You can trade those in at the Rennie Center for, I think they call them Rennie Bucks there. I don't know. They've got a whole PBIS thing going. It's pretty awesome. No, they don't. That would be pretty cool though. Jennifer, well played. 25%. I want you to now calculate the percentage of students who are Asian who have greater than 0 suspensions. What do we get? Pop in the chat when you're done. Race to the finish. Jennifer can't be the winner twice in a row. That's bad for morale. Jennifer with the win, 42%. I'm going to ask the group to answer this question. when we look at that 42% of Asian students have greater than 0 suspensions in this data set, can you on the fly calculate or just take a look at column 2? Are we over or underrepresenting Asian students with suspension in this data set? 42% compared to 13% of Asian students in the district. Molly, there you go. 42 is higher than 13. Pretty significant in terms of overrepresentation. Something is going on there. Now we have to ask why. Does this make sense? It's the last time I'm going to ask it today. I want to see thumbs up in the chat. Yes, we're good.
For white students, it's the other way. It's underrepresented.
Molly,
25% functionally, but it's 30% of the, and I use that, I wanted to look at that as an unfortunate litmus test because of what we talked about earlier, like if it was a high amount for everybody,
yeah,
versus if there was difference between groups.
Right. I want to emphasize something right now. If we rip through the third column, that's the number of students for this data set, right? 130, 270, 300. And then we look at the number of students with suspensions. At face value, well, we suspend less Asian students than we do white students, John. Look, it's 55 compared to 75. That is the wrong way to look at disproportionality data. That's not looking at disproportionality data. You have to look at the percentage. That's critically important. If you only look at column 4, you are ultimately doing your data set a disservice. Column 4 is informing the percentage, but if you use that to tell a story, it will tell the wrong story. It will tell the story in reverse sometimes. I could see someone using column 4 to say, actually, John, we're not going to focus on uncovering this problem of over-suspending Asian students because quite frankly, we suspend less Asian students than we do white students. That is wrong. Per capita, you're suspending Asian students at an alarming rate in this data set. That is one of the most important things I hope you take away from today, is that people will try to paint a picture with the number of students in a data set compared to the percentage of students in a data set. We have to look at percentage, okay? That's critically important. My friends, that's all I have for you. Ton of resources here. Some of it related to today, some of it not. Share seamlessly, steal shamelessly, that's the motto. And I really hope that you'll fill out the evaluation that Ellie's gonna drop in the chat because she's so cool. I hope you got something out of today. I hope this was meaningful, that it supports your work. Brian, thank you for that. Michelle, thank you. It's really critical work. It's hard to do, but I hope you've got some resources now to make it a little easier. I hope you understand the way the conversation has to run such that you can attack disproportionality effectively, that you're calculating data well, that you're using data well, and then you're getting at the why. So I'll stick around for a couple minutes. Please, again, fill out the evaluation. So happy you were here. Thank you for being here. Thank you for your engagement. And you can catch us in upcoming sessions through Thriving Minds. And you can reach out to me if you want to. So thank you so much, and we'll catch you next time. I wish you the absolute best. Happy summer.